Improve your airway, you will improve your aesthetics. And let me share you some secrets that the hard maxers and the looks maxing community don't know because they don't have the practical advice. Everything I'm about to say, I've done or I'm about to do. So pay attention. You need to improve your airway because that's the problem that you don't know you have. You probably have sleep apnea, which is causing you to be tired and depressed and making you stay inside and not getting sunlight. So you need to fix your airway, which will improve your look. So how do we do that? We need to create more bone in our face. We need to create fractures in our face so we can stretch the bone out, which will create more airway space, more volume of that space, so we can intake more oxygen, which will improve our cell function, our brain. It will improve everything, because if you do not have oxygen, you are going to deteriorate. Hypoxia. Okay, you're gonna have ADHD. You're gonna have slurred speech. You're gonna have so many problems that are so connected to your airway you don't even know. So address your airway, guys, and you will improve your looks. And this is how we do it. Okay, so this is for the hard maxers and the looks maxers. You need to do 2 procedures. These are the 2 most important. First, you must do this one first. Do a MARPE, which is a skeletal expansion of the midface. And what does this do? I've done it already. I have braces. What this will do is it's going to make your narrow face that you have right now and your congested nose and your lack of zygos, they're going to put this device with drills. They're going to drill it into you, and they're going to give you a key, and you're going to turn this key, right? And it's going to slowly stretch your face like this. It's going to create a fracture. You'll feel it, and there's going to be a gap between your teeth. And you're going to feel this expansion all throughout your face. You're going to feel the pressure on your cheekbones, around your eyes, around your nose, and your maxilla. You're going to feel everything. And with every turn, it's exponential gains, because airway volume doesn't increase linearly, because there's multiple directions. There's multiple ways to measure it. It's not just this and this. It's like a cave. Every time you expand it by 1 millimeter this way, the volume increases exponentially. So 1 millimeter to 2 millimeters is not the same from 7 to 8, because the gains from 7 to 8 is way more than 1 to 2 or 1 to 3. So the more you turn, the more bone you're going to create, the wider your face is, the more air you're going to be able to breathe through your nose. Your nose is not going to be congested anymore unless you purposely get yourself sick. But if you're healthy, normal breathing, normal everything. Okay? Now, why is this important? This is important because for aesthetic reasons, this mid-face length or width expansion is going to make you look like a more strong animal. Every animal, like a tiger or Rajah Jackson, the guy who assaulted the wrestler, all these creatures that have wide faces, by default, they're dangerous and strong. Think about it. Every predator in the wild is wide as hell. So you want your face wide as hell because it reflects function of your airway. That means with more oxygen intake, you can output more energy. Okay? Now, what is this going to do for you? It's going to give you better under eye support. If you have like sagging skin here, well, if you push your bones out, it's literally going to stretch the skin, and more bone is going to be created in the middle. So it's not going to just be stretched, it's going to be supported by bone. So I don't have very bad hollow eye bags here anymore, and if I do, it's because my sleep schedule is trash. But if I'm rested, they're not even there really, because I have way more bone here. 7 millimeters is the amount I expanded. Your zygomatic bones, they're going to be more projected because you're literally stretching your face like this. So your bones are stretching, your bones are being pushed out, so they're going to protrude more, which is good. It's going to show your bone structure way more. And sometimes if you have like elastics, like a piece of headgear that's pulling the device forward, like rubber bands that are pulling forward as you expand, you can even pull your face forward. But honestly, I mean, if you're down to do that, you can do that. I just don't think it's practical to walk around your whole life. I mean, not your whole life, but like for a month or two, or your whole treatment with this expander, because it's going to look weird and it's going to be interfering with a lot of daily functions. Unless You want to do it, go ahead. But we're just talking about just the Marpy. Your airway is going to improve, and so are your looks. And this is the one thing that looks maxers don't address, because they always say get implants, get fat grafting, which is good. They're all great, but you want to create more bone. That's the peak, and this is the way to do it. And also, guys, you're gonna have a broader smile. So as you see, mine is kind of canted, but that's not what I'm trying to look or make you look at. Look at the corners of my mouth. You can't really see the gaps. You can't see dark caves of like hollow caves of darkness. Like, look up on Google people who have narrow smiles and they smile. It's like a little bit of teeth show, and then right next to their teeth, it's a bunch of like caves of darkness. It's a very narrow smile, and I'm gonna tell you, if the person who has a wider smile is usually a better athlete. That's how it works, because I could tell just by looking at somebody if they have a wide ass smile. Like, look up Rai Benjamin, Olympic champion 400-meter hurdler. The broadness of your smile is going to show a lot about your athletic ability, because if you have a broader smile, you have more airway volume. You have more bone in your face that is expanded and supports that airway volume for you to perform athletic feats. Just look it up. I'm not BSing you. Ever since I expanded my maxilla with the Marpy, my smile has broadened, which is better. Hollywood smile. Cheekbones wider. My face is wider, which makes me more developed, more masculine. Better function, everything. Even your eyes. If you have narrow eyes and you have a symmetrical expansion, you're going to have wider set eyes, so your proportions are going to be improved. And your orthodontist is going to give you a plan. They know how much to expand you, because they have a formula to put your teeth in the best position. And this is the operation you do with the orthodontist. It's a local anesthesia treatment where they drill that appliance into your mouth and you do the rest. You just turn the key slowly. You don't do 10 turns a day. You do it one per day, one turn, because we're slowly stretching the bone. We slowly want to create that bone. You stretch too fast, you break off the connection, and they don't ever rejoin again, or it takes too long to heal, or it doesn't heal right. You want to create the fracture, let the bone heal, stretch it again, let the bone heal, stretch the bone again, let the bone heal, and then once you reach your goal, you stop, and then you let the bone solidify and form to hard ass bone like the rest of your face, and then you're done. Okay? So get a Marpy expansion. A lot of you guys need that. It's gonna help you so many ways, because this is the one procedure that's gonna, just like double jaw surgery, it's like the hybrid. It's not a soft max, but it's not like a 100. It is a hard max, but it's not like the most aggressive hard max, because you're not gonna go under the knife, and they're not gonna do local anesthesia, and it's not super expensive. It's like in the middle. They drill it into you, and then you do the work. You control your fate at that point, which is kind of cool. And you, like I said, you get the benefits. A wider smile, better breathing. If you have a narrow ass nose, it's gonna expand your nose, which is good. Don't worry about the nose aesthetics. Those are one of the easiest to fix. So just don't worry about it. Your zygos are gonna improve, so you won't need implants on your zygos. Your eye spacing is gonna improve. The only negative is if you have an asymmetry, a pre-existing asymmetry, you're gonna expand asymmetrically like I did, and you're gonna have a canted smile like me. It's kind of sloped to one direction, and it might affect your eye region like it did with me. I feel like one of my eyes, it might have collapsed the sinus floor and it dropped lower. It's more deep set than the other one, or maybe the bone, because mine kind of expanded like this, but like that a little bit. So I feel like this eye got pushed up while this eye dropped down just a little bit, because my old pictures, my eye symmetry and harmony was way better. They were more narrow set, but my eyes had way better harmony in the past. But it's okay. I can live with this. It's not like significant enough where it's like destroying my life. But if I ever do want to address it, I could just go do some operations when I have the money. But at that point, maybe I won't even need it. I'm not trying to Frank Tufano my freaking eyes. It's not to that point where it's like I'm cooked. So, as long as your vision is okay, you don't need eye procedures. And as long as it's not like significantly noticeable where people bring it up, if people bring it up, okay, look into it because, you might have a condition, right? Like Graves' disease or something, or a deficiency, or like your vertical box osteotomy, where you might need a procedure like that. A vertical box is something, the deficiency where your eyes are down on the same level, which can definitely decrease your looks. But don't worry about that, guys. We're in the airway, so improve your airway, you'll improve your looks. So the width of your maxilla, not your mandible. This will only affect your maxilla, and you will be golden if you do it correctly. If you do this with the perfect provider who tells you the expectations and it's symmetrical. If you have a symmetrical expansion, guys, like you're expanding evenly on both sides, you're not getting a lot of pain on your teeth, and your eyes are on the same level as you're expanding. Like if your eyes are on the same level as you expand, expand as much as possible that your mandible can withstand, because at the end of the day, you're gonna have to line up your teeth, and if your upper teeth are too wide out, you're not gonna be able to like chew, because they're just gonna pass over the lower teeth. So there's a certain limit that you can achieve with this, and it's not because of the device. It's really your mandible. Your mandible dictates how wide you can go. So if you have a wide ass lower jaw, like my lower jaw was wider than my upper jaw, I was able to expand 7 to 8 millimeters, which is, not a little, but it's a lot, but it's not crazy like 10 or 12. Like once you get up there, it's like whoa, but it's enough to make a difference in your face. Because my family, when they saw me after a month from expanded, they're like, whoa, your face changed. And I asked them, what changed? You used to be like this, and now you're more like that, which is good. And looking at my old pictures, I can see the difference in my face. My face kind of looked collapsed in, like it was like inwards, like squeezed in and in. But once I expanded, it kind of like came out and wide, and that's what you want. So do the MARPI, one of the best hard maxes you can do for your airway. And now double jaw surgery. Double jaw surgery is part 2 to this. And you can skip MARPI if you don't need it. If your teeth are pretty good, you have a wide smile, you nose breathe pretty good, but you have sleep apnea because you don't have enough space in your throat airway, then you can just skip MARPI and do double jaw surgery. So what is double jaw surgery with genioplasty? That's the number 1. You're gonna slice the upper part of your maxilla right here. They're gonna cut your face right here. Then they're gonna cut your jaw right here. And the doctor's just gonna move it forward, rotate it, maybe shave off some bone up here to impact your face like this. So you're gonna go from like a slope face like this. They're gonna do this, and impact it, and maybe a little more here. And then with the genioplasty, it's gonna give you that chin projection. So once you're out here, they're just gonna push that little bottom part to give you that masculine chin projection. And that is gonna solve so many aesthetic flaws that you might have, because once you have a forward maxilla, you're gonna have better soft tissue support here. Your smile is gonna be better. What else? Your jawline is just gonna be visible at all times, especially if you had a genioplasty. So let's say they advance your jaw like 10 millimeters, and then the genioplasty like 5 or 7 millimeters. Man, that's almost 2 centimeters of added length to the both sides of your jaw, which is gonna make a huge difference. And your airway is gonna improve here, because then you can go to sleep. You'll be oxygenated the whole night, not stress your heart out from hypoxia, and you're gonna wake up feeling refreshed, ready to take on the world. You're gonna look great. By default, you're gonna look better because of the more added bone that you're gonna grow from the double jaw surgery. But on top of your mitochondria and your cells getting oxygen, it's like exponential gains. It's like 1 + 1 = 10 in this case, because you got more bone, and then you got more oxygen because of adding more bone. Your eyes are gonna look wider. They're gonna look more alive. You're gonna have better aesthetics, better jaw function. You're gonna have a better smile. You're gonna have better soft tissue support for many more years. Because if you don't have a lot of bone in your face, when you get shredded or when you get saggy, you're where's that skin gonna hang? It's not gonna just sit on bone and still look the same as it was when you were young. It's gonna start to droop down. So let's say the skin right here, guys, it's tight right now, but like let's say it was saggy, it's gonna droop down. But if I had like really strong cheekbones, the cheekbones would just protrude out and the skin would just hang on the cheekbone until very, very old age, like 150 or 120, around there. So that's it, guys. Focus on improving your airway. If you improve your throat airway, that means you're gonna have to move your bones forward with the jaw surgery. That means more bone volume to your face. And if you improve the nasal airway with the MARPE, you're gonna improve the width of your face. So you're gonna get this plus this. You're gonna get transverse expansion and anterior expansion. Okay? More of this and more of this. And that's what a lot of us need. That's what we all need. If we mastered these both of these dimensional planes of bone growth, then we wouldn't need jaw implants. We would not need fillers. We would not need fat grafts. Because if we can grow more forward and more wide, we're covered. All right? And the two procedures to do that, the most common ones and the most safe ones, because there's other ones like where you can just isolate the cheekbone, and then there's ones where you can isolate maybe the eye area, so you can shave off bone here to level out the eyes. Those are just too risky and you get scars, because they have to cut on the outside of the skin for a lot of those. Maybe not the cheekbone one, they go through your mouth. The double jaw surgery, you're not going to get scars on your face because they do everything inside the mouth, because you already got a hole right here. And then the MARPE, well, your mouth heals so fast, those holes are going to heal up and close quick after they take out the drills. So no scars on your skin, but you're going to grow bone just like you did as a child. So those are the two ways to hard max correctly, not just for aesthetics, but for your airway health. And that's what you guys don't know. Airway health is the same as aesthetics. The better airway you have, the better aesthetics you have. That's really it. So yeah, thanks for watching, guys.